Small businesses have no idea what to do, what to expect. They don't know what affordability rules are. They don't know when penalties may apply. They just don't know. People are going to be really confused. I tell you, I just see a huge train wreck coming down. And you and I have discussed this many times, and I don't see any results yet. I just see a huge train wreck.
That's the word used, a huge train wreck. We've been talking about the political aspects of Obamacare. Let's get the thoughts from a medical professional. Let's go to Scott Gottlieb. He's an MD. He's from the American Enterprise Institute and a medical expert and a practicing physician. Scott, thank you so much for being with us today. We appreciate it.
Thanks for having me.
Scott, let me ask you, I was reading one of, a paper that you had written just recently. You were talking about the unintended consequences of the new Medicare payment system. And is that affected by Obamacare in any way?
Well, it's driven by Obamacare. The law really created a new payment system for doctors that the goal of it is to drive consolidation of doctors into larger practicing units, basically to have doctors be salaried employees of large integrated health systems or more likely hospitals, so they become easier to regulate. It's really a throwback to the old model of capitation from the 1990s when people didn't like HMOs.
One of the things that disturbed me in your paper is this concept of bundling the payment.
Right.
Speak to me about that. Could that in any way lower the standard of care that we get?
Well, I think it already is lowering the standard of care. So it's already been rolled out in dialysis. So people who require long-term dialysis because they have kidney problems, the payment for the dialysis service is bundled. And what that means is the doctor gets a lump sum of money for everything. So if the doctor ends up using more drugs or more expensive drugs, more expensive technology, that basically comes out of this lump sum that the physician's getting. So what it does is essentially pit the doctor's income against their choice of technology and gives the doctor a very strong incentive to try to use the lowest cost technology possible to care for the patient. And we're seeing in the dialysis community underutilization of certain drugs and certain technologies that are at least raising the suggestion that patients may be worse off, potentially worse off. So you're seeing, for example, underutilization of drugs that stimulate red blood cell production because most dialysis patients become anemic over the course of their disease. And so now the dialysis patients are requiring more blood transfusions because they're not getting as much of that drug. You're seeing other indicators in the blood work of the dialysis patients that suggest that they're not getting as much of certain drugs as they should be getting. So I think this is going to become a bigger problem once they roll out these bundled payments into other treatment areas. So a bundled payment for the treatment of the patient with a heart attack, a bundled payment for the treatment of a patient with a certain stage of cancer. The idea is to roll out bundled payments in all different kinds of what we call episodes of care, common illnesses, common conditions that people suffer from. And it's really a form of what we call capitation, basically giving the doctor a lump sum to care for the patients and give them an economic incentive to be cost efficient.
That was something that was actually done by the HMOs. That's not a very comforting thought, doctor. Let me take you to another part of Obamacare. Not really a medical issue, but Obamacare is very dependent on young people enrolling, and to many it seems like a big transfer of wealth from young to the old. Now, I remember when I was a kid, I wasn't thinking about health care. I felt I was invincible. I would think it's unlikely that many of them are even going to enroll.
Well, I think that that's probably right. They are dependent upon having the young people in this scheme and basically overpaying for insurance to help cross-subsidize older, sicker Americans who are more likely to get into these exchanges. What the administration's hoping, though, is that a lot of these young people are going to qualify for these subsidies to help offset some of the cost of the insurance. And so even if the insurance ends up being more expensive than what they're paying now, even with the addition of the subsidy, they're hoping that psychologically a lot of people will want to take advantage of a government subsidy to help offset something, even if they end up paying more in the end. So if you look at the economics of this, a lot of those young people do fall within the income bands because, they're young and single and in their first job not earning a lot of money. A lot of them do fall in income bands where they will qualify for government subsidies. Upwards of almost over half, I believe, was a recent analysis.
Well, we'll see how this unfolds. Doctor, thank you so much for being with us. We appreciate it.
Thanks a lot.
That was Dr. Scott Gottlieb.